Hey, how you doing out there? Welcome to McManus Webcast here on December the 12th, Wednesday afternoon. I'm with my good friend, Dr. Aaron Bates from Jacksonville Orthopaedic Institute, JOI, as they're known here on the First Coast, the leaders in orthopedics. Dr. Bates, a former badass defensive back in the day, and a brilliant man out of Towson State. I always embarrass him a little bit. Like, what is it, magna cum laude or something like that?
I can't pronounce it either.
Good to see you. You were just it, but you can't pronounce it. That's great. How you doing, man?
Good.
Good. Happy holidays. Merry Christmas to you. Thanks for joining us here on the webcast. What's been the latest? Any trends with the young athletes? Replacements? What's been going on in your world as of late?
You know, it's harder to see trends nowadays with you know, more sports have been playing all year round. So, but I mean, I've been seeing more, you know, some ankle injuries, and with basketball and soccer going on now with the high schools. But even then, I mean, you see those kind of all year because they play those all year too.
Yeah.
And wrestling is about now, so I'm seeing a lot of wrestling injuries. I've seen a bunch of hand and finger injuries as well, and things that needed surgery actually. So. It's a variety. It's hard to see a trend. I mean, you definitely continue to see some knee injuries, whether they're really bad, whether they need surgery, like ligamentous injuries, versus something that just needs some therapy.
Right. What do wrestlers normally? Rotator, knee? What do they
do? A lot of different wrestling. They get a lot of different
they do.
injuries. But I've seen, you know, finger dislocations. Shoulder dislocations. They get some fractures, things like that. They even have some meniscus tears, knee meniscal tears.
They get stuck and turn and twist, and the torque does something to it.
Yeah, exactly.
Yeah, that's a tough sport.
It's a tough sport.
That's a tough sport, no doubt about that. We've talked about it before, Doc. You know, getting your kid, let them play more than one sport. It's good for them. It's good for them. Changes things up. I just started. You're going to laugh at 42 years old, but I just started getting back into basketball. And I played as a kid, and competitively, you know, doing like 3-on-3. Man, I love it. It's so good. It's so good for you. But as a young kid, it's great for their feet to be able to cover somebody one-on-one.
It's great for agility.
Agility, right? Absolutely, absolutely. Well, you mentioned knees, Doc. It's amazing to me, case after case. You keep hearing it. You know, guys coming back within certain periods of time. We see the success of Adrian Peterson, which is ridiculous. David DeCastro, the first-round pick of the Pittsburgh Steelers, he tears his knee in the preseason. He's going to play this weekend. Marcus Lattimore, the stud running back out of South Carolina, he's now going to come out in the draft. Does anything shock you guys anymore? Is anything surprising when these athletes come back as quick as they can?
You know, the amount of time that they're coming back it's a little surprising sometimes.
Okay.
And some of it, you know, is a little scary too, because you don't want somebody to come back too soon. Where, I mean, you can't speed up biology of healing.
Right.
Okay. You can speed up. You know, people can work harder all the time, strengthen the muscle around joints and things like that.
Right.
But you can't speed up the biology of healing. Okay. Your tissues are going to heal the way they're going to heal. There's certain things that will enhance some of that.
Right.
But, you know, your tissues, it takes some time for things to heal. But all the while you're strengthening the joints around there. Now, you know, coming back to being able to play and play at a high level, well, that's the athlete.
Yeah.
Okay. And so, you know, you can't do that with Joe Schmo off the
right.
street. Right. These
Joe McManus right here.
You know, they're just not as... You know, they just don't have the ability. The athletic ability, the strength, or whatever it is to come back from something like that very quickly.
All right, so take Adrian Peterson. Obviously, phenomenal athlete. Freak of nature. Are you surprised? You know, I mean, he might break Eric Dickerson's record, Doc. A year removed, 7 months. Well, now 9 months removed, but prior to the season, like 7 months.
You know, I'm not as surprised that he came back, but I'm surprised at how well he's doing. You know, I always tell my patients, 8 to 12 months to come back from the injury, from ACL surgery. Sometimes you get them back 6 to 12 months.
Okay.
But I always tell them, you're not going to be any good when you come back.
Right. Yeah, right. You're not going to be the same right away.
Exactly. Not going to be the same. It takes a while. Now, we can do all of the agility drills and whatnot, the strengthening, but until you're into that game speed, you know, and you get used to that, there's no telling like how long it's going to take, to get your response time the way it's supposed to be. When you first come back, it's like, okay, I want to be there. I know I need to be there. I used to be able to get there to that point, but you just can't get there because the synapses just aren't meeting up as quick.
Right.
But he's obviously been doing something to be able to get back and be able to make his cuts and it's just strong. Just running people over and
it's amazing.
Yeah, it is.
It's absolutely amazing.
It's exciting to watch.
It is, and it just coming off. I've had the knee, man. Just coming back to that without thinking about it. Especially running back, they get hit from all angles.
That's right.
Every inch of their body gets hit.
And twisting and whatnot.
Unbelievable. Dr. Aaron Bates here with me from JOI at the Fleming Island office. Check them out right there. Just click on their logo at JOI's space right there on the sponsor page and the home page. And then go see Dr. Aaron Bates. You can even set an appointment right there on the site. Doc, with knees, it used to be a death sentence. You look at a guy like Marcus Lattimore coming out of South Carolina, NFL people are like, okay, let's see how he heals. I'm not going to cast him anything yet. Let's see him, especially after the way we see guys come back. So, where we used to, you get that knee, like, oh, my career might be over. Now it's like, okay, just let's get it fixed. Let's get it tight again. I'll rehab it. I'll be almost as good as new.
Well, I think the NFL is seeing more, and most coaches are seeing more and more kids, more and more guys coming back from these devastating injuries. Just like take for instance McGahee, when he came back from that terrible knee injury that he had.
Right.
When more people come back from injuries like that, well, they're people are going to kind of wait on them now. They know their ability.
Right.
So let's see if they can recap that after getting fixed.
Yeah.
And
he has. It took him a little while.
Yeah.
But he has.
Exactly.
I think he might have been the beginning of what we're talking about, and that was back in 2003, right?
I think so. It was at Ohio State.
The national championship game, right?
Ohio State Miami, He's been pretty amazing.
It's unbelievable. Yeah. My good friend John Wade, who had a very similar injury, played center for about 12 years in the league. When he was at Tampa, got his foot caught, ripped it, kneecap up in his thigh. Shredded the whole thing. Played and started every game the following year, and did it in October.
Yeah.
It has been going on for a while, but it just seems now it's getting even better and better and better.
And it's not, a lot of it goes to the surgery, yes. A lot of it goes to the individual, definitely. But then, the rehab is much more involved now, much more aggressive, as well as being able to protect the tissues that's healing at the same time. So that, I think, is a big, a reason why these folks are getting back quicker.
Yeah. Well, it's medicine. Look at Tommy John's surgery. You've been done.
Yeah,
it's over. You're never coming back, and now they're coming back in a year, like Steven Strasburg did for the Washington Nationals. All right, so for people that have had a knee out there, and knee, ACL, reconstruction, MCL, whatever the case may be, what's the percentage that when they're older, they may need a replacement, or they're going to have problems with that knee so much to a point where you're like, you know what, it's going to be so much better for you when I replace this knee with an artificial knee. And I've had relatives, both knees done. They love them. Now they're in their 70s. It's titanium, I believe, but they love them. It's like it's never even happened. So, but take me for an example. Had the ACL, the meniscus in '97, got arthritis in there. Am I a potential candidate for a replacement when I'm a little bit older?
Well, first of all, total knee replacement, a total joint replacement in and of itself, total hip, total knee, and maybe even total shoulder. Probably the most successful surgery, hands down, in the 20th century.
Wow.
Not really just orthopedics, but hands down for giving folks their quality of life back. Right. So we've been able to increase longevity, right? Like the time you live. But now we've been able to increase quality of life because people have bad knees. It's hard for them to get around and whatnot. And the reason we do joint replacement is because of arthritis. Normally it's osteoarthritis, sometimes rheumatoid arthritis, but normally arthritis or post-traumatic arthritis. Right? So how do you get arthritis? Some is genetic, just the way you're made, your family history and whatnot. But mostly. Or some others are genetics plus having some type of injury. and then some type of surgical intervention because of that injury.
Right.
Now, the surgical intervention may have slowed down the eventual onslaught of that arthritis and the degeneration of that joint, breaking down the cartilage and whatnot.
Right, right.
But eventually, if you've had an injury in your knee and you live long enough, you're going to have arthritis.
Right.
That's going to affect you. It's
That's
going to
just
affect
natural.
It's going to affect your life. And so, but it doesn't make a difference. I mean, it doesn't. We can't really predict.
Right.
Okay, you have an ACL tear and get reconstructed.
Right.
When you're going to have arthritis.
Okay.
Some of it depends on how long you live. Some of it depends on how you preserve your knee and how active you are. If you're doing the right things when you're active,
right,
and what things you like to do.
Yeah.
If you had an ACL tear and you love to run, well, that's not really good for your knee.
Right.
Right. Those high impact exercises are going to wear your knee out quicker than the low impact exercises such as walking, elliptical, cycling, swimming, those types of things.
Right.
And with that said, I love to pick up basketball. I play at least once a week.
Yeah.
On Wednesday morning. Now I used to be able to play like 3 times a week.
Oh, right.
Yeah. I'm getting to the 40s, man.
I know. I played yesterday and I'm dying.
Yeah.
I mean, I'm sore as can be today.
Yeah, I know my knee can only take once a week.
Right. Yeah.
And I probably shouldn't even do that, but that's something I love to do. So
yeah,
it's quality of life too.
Right.
I know at some point in time I'm gonna wear out my knee.
Right.
And so that's what I tell my patients. At some point in time, you're going to wear out your knee. It just depends on how quickly that happens.
You go by pain, don't you, if you're the patient?
Sure. Yeah.
Where it gets to a point like I just can't take it anymore.
Yeah.
I need a new knee.
Exactly. So we like to get you further up in the age before you have a knee replacement, so that you may only have one in your lifetime.
Right now, what do they last? About, depending on, obviously.
You can get it out 20 years now.
You can get 20.
I mean, it
used to be 10.
It used to be 10, right?
Yeah.
It used to be 10 and 15. Now it's about 15 to 20 with the over 90% success rate or survival rate of the implant. And it's because a lot of it's because of we're getting better at doing it. Plus, the technology of the bearing surfaces are starting to hold up with people's lifestyle.
Right.
So, and also, the younger you get it done, the younger you are, the more active you are.
Right.
And that's why it wears out a little quicker if you get it done the younger you are.
How long does it take to do it? I mean, for you to do a replacement?
The guys that do it all the time do it 40 minutes.
No kidding.
35, 40 minutes to a couple hours.
Okay.
So I mean, it just depends. Depends on how many you do. Depends on your surgical team. But time to do it versus doing it well.
Right.
That's the bottom line. You got to do it well.
What do you like? And I don't know how technical we can get, with this period of time. But are you breaking bones? You're cutting ligaments. What are you doing?
So with the total knee replacement, basically you're cutting out all of the articular cartilage, what's left, because that's what's worn down. So you have to make certain cuts in the bone to shape the implant, the back of the implant that you're putting on.
Okay.
We definitely leave the ligaments on the side, the collateral ligaments, MCL and LCL, intact.
Right.
And we usually cut out the ACL at least. Some people do something called a PCL sparing, meaning you leave the PCL intact, because some people think that gives you some neuromuscular control of the knee, that gives you better mechanics of the knee, but most people cut it out, and so you cut both cruciates out and you put something called a posterior substituting or a posterior stabilizing implant in. And so there's metal on both sides, and then a big plastic piece, very hard plastic that's pretty durable, called polyethylene on the tibial side of the metal part, and something that holds that in. And so it's the plastic that articulates with the metal. Okay. And the same thing if you resurface the undersurface of the kneecap, basically you cut that out, make that flat, and put a big piece of plastic on that.
Yeah. Gosh, you just hearing you talk, you got to be up to speed and evolving with information and how to do it better and more efficiently and everything. That's fantastic.
With the time, you got to keep trying to improve. Just can never rest on your laurels. You got to keep trying to improve.
Right. Isn't that a lesson for life? No doubt about it. You mentioned finger injuries. The other topic we were talking about, wrestling. Des Bryant has got a broken finger, and not knowing the exact magnitude of it, he says, "Hey, I gotta have a broken leg before you take me out." Now he's catching passes from Romo, and they come in hot sometimes. That's just got to be a pain thing, right? You got a broken bone in your finger. You may put a splint on it. You may not. You're just gonna have to suck it up and deal with the pain, I guess.
It's going to be hard to imagine how he's going to be able to stand that if he plays with a broken finger. Now, I don't know the extent of it. I don't know where it is in his finger. I don't know which finger it is. But if the hand surgeon is recommending either surgery or non-operative treatment to let that heal before it goes back to play, it's probably because he's at risk of doing further damage to the finger, right? And he's a receiver, right, so he needs his hands. Yeah. So
it's playoff time, though, Doc.
Yeah,
we fight for playoffs.
He gets paid a lot of money to do what he does.
That's right.
He can make his own decisions as what he wants to do or not wants to do as far as that's concerned. So, but it's. Let's see how he does.
Yeah.
I mean, it's not like
he's tough.
It's not a DB like Ronnie Lott. Just say, cut it off.
Yeah, clip. Yeah. What was it? Tip.
Yeah,
clip it right
cut it
off.
That's
great. That's fantastic. All right. The final thing I want to talk about on this webcast today, on December the 12th, is Dr. Aaron Bates with JOI at the Fleming Island office. 904-276-5776 is his office line. And I want to pinpoint just Terrell Suggs, but I'm going to because he's had a couple major injuries in the past probably 9 months calendar year. He blew out the Achilles he came back from, which was incredible he came back from. Now it looks like he popped his bicep tendon. Ray Lewis popped his tricep tendon. We see guys all over the place, not just on Baltimore. Look, I do think, in my opinion, if the NFL wants to do something about performance enhancement, they could. Now, you don't have to get in on that, Doc, but I just want people to understand. I want these young athletes especially to understand. And however you do it, but you overload those muscles. If they're so big, you may look great. You may feel great. You may look in the mirror and be like, man, I'm pretty dang yoked, and I'm pretty cut, and I'm feeling good, and I'm faster than I've ever been. I could jump to the moon. I could do everything that I could do 30 pounds lighter. However you got there, you have to understand that you are weakening the attachments. You're weakening these ligaments, right? I mean, I'm no doctor, Doc, but I know that much. They get weaker where they attach, correct?
Well, I don't know if they get weaker. The thing is that your muscle, the muscle unit is getting so much stronger than the attachment site that it's easier to pop the attachment of the tendon or injure where the muscle attaches to the tendon. Okay. So muscle. So it goes bone, tendon, muscle, belly, tendon, bone. Okay. And so if the muscle is very strong and stronger than it should be, maybe at risk for injuring the bone tendon attachment or the muscle to tendon attachment.
Right.
And so, we see that. I mean, those are types of, and I don't know what people are doing here, but those are types of injuries that we used to see with folks that were on, the performance enhancing drugs, things like that.
Yeah.
It always crosses my mind when I see somebody in the office with that type of an injury.
Right.
Now, it doesn't mean that they have to be on that.
No.
And not all bodybuilders or weightlifters get those injuries.
Right.
I mean, some other people get those injuries too.
Right.
But you do see quite a few of those folks get that type of injury.
Speed over bulk. To all the athletes out there, I'm telling you, for a guy that struggled with speed, I wish I was a step faster, or was a step faster back in the day. Now, I had my other attributes, but if you can have flat-out speed and athleticism and agility, take that over bulk all day, any day of the week, especially when you're in grammar school, high school, even getting into college. Of course, you're going to have to match up a little bit of size as you get older, but you will naturally, just because that's the way our body tends to work. But be careful. And I was a meathead. I mean, I grew up in the 80s. What do? We lifted weights. How much you bench? I mean, that's all you ever heard, but that was the whole culture of it. And I think it's better today with all the different facilities available.
I was about to say, all the high performance facilities now. I mean, they are promoting more, agility, more speed and agility, and power movements, or like plyometrics and things like that.
Yeah.
Burst of speed.
Yeah, exactly.
It seemed like they're doing the right things. Some people just get caught in the gym too long.
Yeah. Well, I tell you, the Achilles tendon to young people, it shouldn't happen.
It shouldn't happen.
Right?
No,
unless it's freak, unless something crazy.
Yeah, there's some freak injuries, but yeah, it shouldn't happen.
Shouldn't happen.
That's an injury that we see late 30s, early 40s, into the 50s.
Yeah, exactly. All right, Dr. Aaron Bates, great stuff, man.
Awesome.
Thanks for joining us here on the webcast. Check him out right there, joionline.net, or just click on the logo and check out his expertise. You can even set an appointment. Again, his number is 904-276-5776. The leaders in orthopedics, the official sports medicine partner and orthopedic doctors and surgeons of the Jacksonville Jaguars. I've known them for a long time. You can trust in that. Whether it's a consultation, a second opinion, a replacement, or you need surgery, I endorse JOI, Jacksonville's Orthopaedic Institute, and I endorse this guy right here, Dr. Aaron Bates. Hug the ones you love. Tell me you love them, and we'll see you next time right here on the Tom McManus Webcast at SuckItUpUSA.com. Have a good one, everybody.